I'm Hannah Ostrom, Director of Marketing at Pulsara, and I'm joined by my coworker Scott Stanley, who has also served as a paramedic and a nurse before becoming a client services manager with us. Scott was instrumental in supporting the clients that you'll hear from today, Latrobe Regional Hospital and Ambulance Victoria, and in their words, has become like a friend to them. So thanks, Scott, for your service. Pulsara is a healthcare communication platform that connects your entire care team, regardless of where they're located, on one platform around any patient event. So I would be willing to bet that most of us in our personal lives use our smartphone for just about everything. So for example, you would never fax or page your spouse your grocery list. Instead, you just pull out your smartphone and fire off a quick text. And if we also think about Amazon, on one platform, we can browse millions of products, identify the one that we want, they'll process our payment information for us, and then in real time, we can track our package and see exactly when it's going to arrive at our doorstep. Yet when it comes to our most critical communications around time-sensitive emergencies, we're using a much less sophisticated system. So this communication ends up putting our clinicians into silos when they're trying to patch together radios, pagers, fax machines, etc. And so ultimately, this leads to miscommunication and delays in treatment. So rather than healthcare communication looking like this top line with the siloed communications, Pulsara replaces all of those old technologies and brings your entire care team together on one united platform around the patient event. So they can then communicate on that platform using live video, live audio, instant messaging, image transfer, etc. And this really benefits in a number of different ways. First of all, providers. And so, for example, we spoke to a number of neurologists, and on average, they said they were making around 14 calls per case just to try to relay that patient information to the rest of the care team. Instead, with Pulsara, it just takes a tap of a button and they can send that message to everyone else who needs to see it instantly and securely. We also improve the patient experience by reducing time to treatment on average 30%. We benefit the community by improving systems of care and improving patient safety and thereby population health. And we help to reduce healthcare costs and ensure that your facility can avoid wasting precious resources. So Latrobe Regional Hospital is a teaching hospital located 150 kilometers east of Melbourne, and they care for a population of just over 260,000 people. The emergency department sees around 30,000 patients per year. And then Ambulance Victoria responds to more than 840,000 emergency and non-emergency calls every year. And they do around 660,000 transports, including to Latrobe. So together, Latrobe and Ambulance Victoria work to streamline and improve their communication for their most critical patients and achieve some really incredible metrics. For example, just a 7-minute average door to CT time for stroke, which is a 68% decrease in their previous times before implementing Pulsara. So to tell you a little bit more about what that process looked like and how they accomplished those results, I'm excited to introduce the team. We've got Janet May, who's a stroke and Pulsara coordinator at Latrobe, Carolyn Beltrami, an emergency nurse at Latrobe, Mark Scammell is an operational community engagement liaison coordinator at Ambulance Victoria. Jessica Shepard is an operational community engagement liaison coordinator at Ambulance Victoria. And then finally, we wanted to give a special thank you to Professor Christopher Bladen, who was unable to join us on today's call, but he's a neurologist at Ambulance Victoria and Monash University, and is the director of the Victorian Stroke Telemedicine Service, which was absolutely instrumental in bringing Pulsara to Victoria. And the team stressed that without him, this wouldn't be possible. So thanks again to Dr. Bladen. So thank you all very much for joining me. To start us off, could you just tell us a little bit about what your communication process was like between Latrobe and Ambulance Victoria before Pulsara, and kind of what made you realize that you needed a solution like this?
We used to have what we call the bat phone in emergency, where it was a dedicated phone line that the ambulance would call, but quite often the reception would be quite scratchy. We wouldn't always get the correct patient details over the phone. Yeah, and we wouldn't get a full picture of what was coming in before we had Pulsara.
And as far as Ambulance Victoria goes, we had to obviously make a phone call when we were quite busy, and it became quite difficult at times. And because ED was quite busy, lots of times there was a delay in them sort of trying to answer. So yeah, the process was very not consistent, I would suppose would be the wording.
We'd often find that the patient details were difficult to hear over the phone. So we'd get a history for a patient that wasn't the patient that was coming in, just because of scratchy lines and poor reception in some of our outlying areas in Gippsland.
And so what have been some of your biggest wins or the biggest changes that you've seen since implementing Pulsara?
I think from a stroke perspective, our biggest win has been, as you mentioned, our door to CT times. What we're able to now do is the ward clerk can get the patient's medical record number, put it up on the system, it gets sent through to CT. We can then pre-register the patient on the CT scanner. And with the ETA on Pulsara as well, we can make sure that the CT scanner is cleared before the patient arrives. And they've shaved, as you know, quite a bit of time off our door to CT times, 68%. So that's been a huge win in our stroke care. We can get the patient straight into the CT scanner now, and then we do the AV handover in there.
Yeah, that's really incredible times. Has there been any other wins as far as, I would say, provider experience or team communication?
The relevant information is always received by the hospital, rather than inconsistent information that previously was provided over the phone, with each paramedic potentially providing different information, some relevant, some or omitting relevant information.
It also gives a chance for AV to send through a lot of general information, when we would normally ring for any critical patient. For any critical patient needs now can be put on Pulsara. So it's not just for stroke for us, it's for obviously for across the board. Then AV know we can let the hospital know, and then once the hospital know, we know that the right people are going to be in ED waiting for us when we get there, which has been a big bonus. That it improves our handover time, and it improves our downtime too as well. That we can get patients moving fairly quickly. So it's being able for us to pass all that general information for any patient we would normally telephone for, which is our critical patients. So it saves a lot of time for us, and preparation by the hospital, and being able to send ECGs and observations and those sort of things as well has been a great bonus, that we can send that through the hospital and they can see everything before we get there.
Absolutely. And just to add to that as well, I think communication with our internal teams has improved quite a bit, because all that information is sitting on Pulsara. We can shoot that off to the registrars or paediatric teams, or transfusion nurse if it's a trauma as well. The surgeons come down for trauma, and especially for patients with complex needs, you can see it all on the app. So it's instead of multiple phone calls internally, we can just shoot it through on Pulsara, and it's certainly sped up that process.
So with the increase in numbers that we actually had in an already busy emergency department during the peak COVID time over here, to actually get the notification of patients who are potential COVID risks coming in, actually meant when you're working on the floor in the emergency department, you could streamline and move beds around and get things organised and be ready for the ambulances when they arrived, so they weren't sitting outside waiting with a potentially infective patient. And we actually had quite a few of those come through in the peak times.
Yeah, that's hugely important. Was there any other ways that you used the platform for COVID-19, to help I guess, protect or preserve PPE, or to allow clinicians to kind of see the patient without having to actually enter the room. Did you use it for any of those kinds of benefits?
Yeah, just from AV side, the pre-notification was really important. That we found that other hospitals around the state, we had ambulances sitting in A&E bays wanting to be unloaded for significant amounts of time. Having this pre-notification has meant that we've had basically someone to meet us when we sort of get there, and it's saved us. Our figures haven't really changed during COVID, where everyone else in the state has had quite a significant delays unloading patients. So it's been a huge thing for us to be able to unload our patients far quicker.
And so Mark kind of alluded to this, but Pulsara is used for any time-sensitive emergency or any patient event. And in some ways, you all are kind of pioneering new ways of using the platform. Could you talk a little bit about maybe your other cases, such as how you're using it for mental health or pediatrics?
Yeah, so if we have a mental health police response unit, but we're about to onboard as well. But if they have, the AMBOs are bringing in an acute mental health patient, we can add the mental health triage staff onto the case. So they're alerted that the patient's coming in, and then they know the ETA. They can pull the patient's history up and see if they're an aggression risk for staff or any other alerts on the patient. So they will also know who's in their department that's coming in. Pediatrics has been good in that, especially over the winter season with croup babies and that sort of thing. We can add the pediatric team onto the case as it's needed if we have a sick ped in resus as well. Kaz, did you want to add anything to that? Because you were down there more than me.
Trauma, it's been fantastic for trauma because often the surgical team are aware of the trauma that's coming in. So over my night shifts recently, I actually had the surgeon waiting for the trauma case to come in so they could see a potentially unwell patient who'd been in a high-speed car accident. The mental health one has been fantastic because we actually had multiple mental health people come in over the weekend, and just to know that they were aggressive, had been sedated, sorry, so we knew what sort of cubicle, whether they needed to go to resus or whether they could go down to our mental health area, made it much easier to run a very busy Saturday night in an emergency department.
Yeah, that's incredible. Do you have any plans to use it for any other types of cases, or expand it, I guess, in any other ways?
We're looking at implementing it for inter-hospital transfers now within our region, especially for COVID patients coming in. So if they want to transfer, we are the designated CCU COVID unit for the region. So if other peripheral hospitals want to send a patient up, we're just in the process of setting that up at the moment to help streamline that as well.
So, and from our perspective in that way, it means that we'll actually get more users on board. So we'll have more paramedics across the state using the app and getting hopefully ready for it for the future if required. And it also means that we can use it in between inter-hospital transfers if the patient status changes, to update the destination hospital so that they're able to adapt as necessary before we get there. So hopefully we'll have a few more users on board and continue to grow across the state.
Also, the potential to add on to inter-hospital transfers, not just for SCOVID patients, would be that we could add our mental health transfers, where we get a lot of those from the hospitals that we're going to be taking COVID transfers from. So that's another area that we probably need to look at. I had, I think, 5 or 4 transfers from Wonthaggi over the weekend and no notification. So it's going to be really, really great to actually get that area up and running and maybe add the mental health, which would help us out as well.
Yeah, definitely. So question kind of for Jess and Mark. We often hear feedback that ambulance teams don't feel necessarily as integrated into the care team sometimes when they're using radios and pagers to try and communicate. How has Pulsara helped you feel like a continuous part of the care team?
It's because we're being sort of more involved with right from the very start. So we're involved in all of that, obviously all that initial management of the patient. We're able to then obviously send the information through, but as the patient then travels through ED and through other departments, they've got the ability to keep updating the Pulsara app. So that means our crews can then go back on that case and have a look at the case and see what outcomes were for that patient, which has been a really big thing, that we actually get a chance for some follow-up like that, rather than have to chase up later on at the hospital and try and talk to somebody and try and find out where that patient went and what happened with them. It gives us that more detailed of, okay, so we know what actually was involved with the further management of that patient. So for us, as a follow-up and as a training tool as well, the crews can have a look at it and go, okay, that's, yeah, our management was heading down that line. So yeah, so it's a very good platform for that whole integration of our management from the start, and then seeing what the end results are.
I think too, we're able to be a bit more involved in the streamline of patient care. So if we can start, notify the hospital and start assisting them in getting the appropriate teams organised, it means that when we do arrive at hospital, the patient transition from ambulance to hospital is much more streamlined. They're already aware of the patient's general condition, and we can just add in any little bits and pieces verbally that we need to. So it just means that the patient care is improved, and yeah, we're able to streamline the process and transition of care a lot more easily and a lot quicker.
Fantastic. Thank you for sharing that with us. I think probably final question, and kind of a big one, but how has Pulsara and streamlining your communication changed your approach to patient care?
I think in an ED perspective, we're better prepared for, and as we've got more information about, what the patient is that's coming in, especially for the high acuity patients, we can see, what their GCS is, what their OBS are. If they've been in a trauma, they take a photo of the scene and you can see the impact, and then you're a bit more aware what the potential injury is that's coming in. So we can be a bit more ready, I guess, for the AV crews and have the right team in resus when they arrive.
And from an AV point of view, that's a huge thing for us, that we can actually streamline our movement when we arrive at the ED department, rather than sometimes without much notice, and then it's sort of a bit of a madhouse. We can actually then, they know we're coming, we're ready to go, and it gets us to be able to unload our patients far quicker and hand over to the right people. So you're not trying to hand over 2 or 3 times as another doctor comes into the area, who's more specialised, might want to know a bit more information, with the early notification that those people are already in the room. So it streamlines patient management as well.
And two, being able to convey information without having to spend time. I know I've been up in the mountains and not had any radio access, and we're either trying to get radio access or phone access, or have to wait until we get into an area where we do have phone reception. Instead, now we can actually just quickly get onto the app, send off the information, and we know that it's going to get to the destination, and we have more time to spend caring for our patient, rather than trying to get through continuously without success.
With increased numbers of patients, particularly during the winter period, where we saw COVID patients, and we had the flu and the pneumonia type patients, the respiratory things, it certainly helped the flow through the emergency department and movement of patients. So better patient care ultimately, because they're not waiting around. And as Mark stated, we're actually unloading our ambulances with the increased numbers still in a timely manner.
Yeah.
And just one other thing to add to that as well, I think it's useful for the ED staff. Like previously, when we just had the phone call come in, we had no way of checking details, like if we had another question or we didn't think to ask them this, or were they collared, or just to confirm details on the patient. We can now message them back or ring them back through the app, whereas we would have to go through the controller first to try and find out any more details of what was coming in.
Gotcha. Yeah, Really powerful testimonials. Thank you so much for watching our presentation today. And if you have any questions, feel free to visit our website, pulsara.com, or you can reach out to Scott Stanley, who is on this webinar. His email address is on the screen, or our local Australian contact, our regional director of APAC is Michael Drummond, and he's on his email address is on the screen as well.